What if you grew up in a world that wasn't built with you in mind? Nothing would fit right. Sometimes you might get some help, but most of the time you'd be on your own. How would that leave you feeling? Disempowered? Alone? Invisible? Many women experience this constantly in their healthcare. Why? Well, it's complicated. It's historical and systemic. So even pinning down the issue is hard because most of us are blind to this situation. In every generation, great women have seen disparities and fought for equity. Voting, politics, and so much more. Each win has been a reclamation of our power. But until now, the imbalance of women's healthcare has gone almost entirely undocumented, so we couldn't see there was a problem. Did you know women's health was generally assumed to be the same as men's health? So the male body became the baseline for health research, education, and practice. This assumption has some obvious flaws and has resulted in dire consequences. Women experience up to 75% of reported adverse drug reactions. Women have experienced years of delay in diagnosis and are often misdiagnosed. And women are more likely to die prematurely from largely preventable illnesses like lung cancer and cervical cancer. In BC, it's not any better. When we asked women across the province about their unique healthcare needs and experiences, their answers revealed some startling realities that we can't turn away from. Over 4 in 10 women in BC reported a chronic health condition. 1/3 feel like their needs are not being met by the healthcare system. For Indigenous women, it was nearly 3/4. More than half of the women we asked have felt their symptoms were diminished or overlooked by a physician. Studies have found that regardless of their gender, doctors tend to have unintentional biases against women. Women's physical pain is more likely to be diagnosed as psychological. Women tend to be given less pain medication than male patients with the same symptoms. And women are less likely to be admitted for further testing or to specialty clinics. We all know that healthy women benefit families, communities, and the economy. So despite the decades of progress in healthcare, the system still desperately needs to be rebalanced. It's time for women's health to step into the spotlight. The BC Women's Health Foundation is here to champion the cause. We're rocket-fueled and ready to take women from invisible to invincible. As a Women's Health Foundation, our goal is to solve these fundamental inequities, eliminate gender bias in healthcare, and leapfrog over systems that marginalize women. We do this by fundraising for facilities, equipment, and programs at the BC Women's Hospital, investing in women's health research to better understand and treat women's health, driving education and awareness to open up the conversation, and advocating for public investment and changes to policy and practice so that women's health becomes a priority across our province and beyond. We're radically changing the tide on women's health, and we need other champions like you to step up. So how can you help the movement? Donate, educate, and advocate. As donors of the BC Women's Health Foundation, continue to support the work we do. As followers and influencers, spread education by sharing stories and new research on women's health. And as a woman or a champion of women's health, advocate for your own health and that of your mother, daughter, partner, sister, colleague, employee, or friend. BC Women's Health Foundation. Healthy women everywhere, capable of anything.